Thank you for choosing TV47 to inform you. A lot is indeed making headlines. Let's get you informed. I am George Maringa. The medical fraternity is once again in mourning after the loss of a young doctor, that is Dr. Francis Njuki Gashimo, a 29-year-old medical intern at Thika Level 5 Hospital, who tragically died by suicide in his rented house in Kiganjo Estate on Monday. In the wake of this tragic incident, the Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU has issued a strong statement expressing grief and raising concerns about the mental health crisis among healthcare workers. KMPDU has highlighted the immense pressure and challenging working conditions faced by medical professionals in the country, emphasizing that many young doctors struggle in silence due to overwhelming workloads and inadequate support systems. The union has called on the medical interns to stay home until the government sees the need to heed to their demands.
As a union, we find these inhumane acts by government that does not care about the health of its workers. This is unacceptable behavior. And therefore we demand that these intern doctors that are currently working, that have labored for the last 4 months, be paid their salaries immediately, as per the CBA agreement that we signed 7 years ago. We don't yet know what is new with this government, that have decided to reinvent the wheel. That the payment that has been done seamlessly for 7 years is now causing death, mayhem and suffering of doctors who are expected to offer services in the hospitals. We have had rhetorics and calls and talks about universal health care. But we want to ask, how is universal health care deliverable when the government is out to kill the same persons who ought to offer these services in the hospitals by ensuring that they're not paid, they're not supported, they're not motivated? It is not possible. After careful deliberation by the branch leaders and by the union in entirety, we are asking all the medical doctor interns across the country, in all the facilities, to stay at home immediately. That we will not afford to see any more deaths out of desperation, despair, and disillusionment that are caused by hard-working conditions.